Hello, everyone. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about another topic. Today, we're going to talk about cerebral palsy. Cerebral palsy is a condition that affects movement and posture due to damage caused to the developing brain, usually in pregnancy, but also can occur during the process of delivery due to lack of oxygen for a prolonged period of time during complications that could ensue as a result of the delivery process. Now, the symptoms from cerebral palsy are wide and vast, and they can vary from person to person, from minor to severe, but common symptoms can affect oral motor function, so ability to use the muscles responsible in controlling our saliva and our ability to swallow and speak. So there can be speech impairment. There can also be motor dysfunction affecting various areas of the body, and you might have heard some of the terms like monoplegia, diplegia, hemiplegia, or quadriplegia. And these terms are used to describe the level of involvement of motor dysfunction in cerebral palsy. So, monoplegia meaning it's affecting one limb, like an arm or one leg. Diplegia meaning it's affecting symmetrically the legs or the arms. Hemiplegia meaning it's affecting one side of the body, so the left arm, the left leg. And quadriplegia meaning it's affecting all four limbs. And increased muscle tone is common in cerebral palsy, so spasticity is another term we use for that, meaning that the muscles are stiff. So sometimes the hemiplegic gait of cerebral palsy can look like scissoring. So the adductor muscles tend to be tight, and it's hard to separate the legs to advance them forward, like when we walk. So imagine that these muscles that close the legs are tight. So when they walk, sometimes they have this difficulty in advancing the leg because it's spastic, or the increased tone keeps those knees together rather than the typical spacing that allows easy forward momentum of the limbs. Now, it also can affect intellect, it can affect bladder and bowel control, can affect sleeping. Also, there are behavior abnormalities that can ensue, vision impairment, and a host of other things. Now, being diagnosed with cerebral palsy certainly does not mean you cannot live a fulfilling and meaningful life. It's very important to have supports in place. So, what can we do about cerebral palsy? There's no cure for cerebral palsy, but there's certainly things that we can do to help make life more enjoyable, fulfilling, and empower those with cerebral palsy to live the most effective lives that they can. So I just want to put that out there, that is important to empower individuals with disability to do as much as they can to live their best life and achieve all that they're capable of truly achieving. Now, one is making sure you have a physician supervising you throughout your life. Physical medicine and rehab is the specialty that is focused on restoring function, quality of life, mobility, and reducing pain and the negative effects and feelings that can come from a dysfunction that someone is living with. So you want to have a rehab physician on your team to make sure that you're getting referred to the specialists you need, like physical therapy, occupational therapy, speech therapy, neuropsychology, and other specialists that might be able to help you in dealing with your specific issues that you face with cerebral palsy. Also, you want to, as caregivers, make sure that you are in a role of advocacy and teaching that individual how to advocate for themselves. Even if they cannot speak, they can use gestures or signs or technological devices to assist them in communicating. There are also mobility devices or durable medical equipment like loft-strand crutches, walkers, hemi walkers, different devices to help support them so that they can do as much as possible given the limitations that they are living with. And it's also important to enroll them in programs in school that are geared to those with disabilities and make sure they're going to a school that can accommodate their needs. So, these are just some quick tips for living with cerebral palsy and some information on what it is. And if you are someone suffering with debility or a caregiver to someone who is and would love to partner with a physician who's committed to helping them achieve increased mobility, function, and quality of life at home, I invite you to join me at Freedom Wellness Physiatry by booking an appointment at www.freedomwellnessphysiatry.com. Physiatry spelled Physiatry, or call us at 240-339-5377 to book an appointment in the DMV area so we can start your journey to living better. Thank you, and I'll see you next time. Bye-bye.